Not everyone fleeing a dead-end job wants to spend 4 years and a fortune on college, or to deal with blood and trauma. Good news, healthcare is full of clean, fast-track jobs you can start in around 6 months to a year with no degree, that pay well, and that an aging population needs more of every single day. These are 7 medical careers with no blood, no gore, and a short, cheap path in. We scored each on 2 things you'll see on the card: how fast you can start and whether it's worth it. And the number 1 job is clean, quick, and can pay into 6 figures. Let's start at number 7. We start in one of the most familiar places in healthcare, behind the pharmacy counter. Every prescription that gets filled passes through the hands of a pharmacy technician, counting, labeling, mixing, and managing the medications a whole community depends on. It's clean, it's steady, and the demand never stops. Pharmacy technicians prepare and dispense medications under a pharmacist, earning from $40,000 to $55,000. You can certify in roughly 6 months to a year, no degree, and walk into a job in any town in the country, retail, hospital, or mail order. It's clean, indoor, no blood work with rock-solid demand as prescriptions climb every year. A great first step into healthcare. And with new medications and an aging population, pharmacies are hiring faster than they can fill the chairs. Speed, 8. Worth it, 8. Here's one most people have never even heard of, and you never have to see a single patient. Before any surgery, every instrument has to be cleaned, sterilized, and perfectly arranged. The person who does that, behind the scenes, is the quiet reason operations are safe. No patients, no chaos, just clean, careful work. Sterile Processing Technicians decontaminate and sterilize surgical instruments for hospitals, earning from $45,000 to $70,000. The training is short, often 4 to 6 months, no degree, and you work away from patients entirely in a calm, back-of-house environment. Every surgery in the building depends on you, so the job security is excellent, and the path up into management is wide open. Hospitals run around the clock, so the shifts and the overtime are always there. Speed, 9. Worth it, 8. The heart tells its story in a line on a screen, and someone has to capture it. EKG technicians hook up the sensors and record the electrical rhythm of the heart, giving doctors the picture they need to catch trouble early. No needles, no blood, just electrodes, a monitor, and a steady hand. EKG and cardiographic technicians perform the heart test doctors rely on, earning from $45,000 to $65,000. You can train in as little as 4 to 6 months, no degree. It's clean, calm, in-demand work, as heart disease keeps rising and the population ages, and it's a natural stepping stone into higher-paid cardiac and monitoring roles. Cardiology departments and clinics are expanding everywhere, and they need these techs yesterday. Speed, 9. Worth it, 8. If you like helping people and working with your hands a little, this one's a hidden gem. When someone needs glasses, the optician is who measures, fits, and crafts them to sit just right. It's part healthcare, part craft, part retail. And almost nobody thinks of it as a fast, no-degree career. But it is. Dispensing opticians fit and supply eyeglasses and contact lenses, earning from $45,000 to $80,000. You get in through a short program or on-the-job apprenticeship and a license, no degree. It's clean, friendly, no blood work, and because everyone's eyes change with age, the demand is permanent. Opticians who go on to manage or own a shop do considerably better, and as screens age everyone's eyes early, the customers simply keep coming. Speed, 7. Worth it, 8. Now, one of the most surprisingly pleasant jobs in all of medicine. While patients sleep, a technician sits in a quiet, dim control room, watching their brain waves and breathing roll across the monitors to diagnose sleep disorders. It's calm, it's high-tech, and it's about as far from blood in emergency rooms as healthcare gets. Polysomnographic, or sleep. Technicians run overnight sleep studies and read the data, earning from $50,000 to $80,000. Training runs roughly 6 months to a year, no degree. With sleep disorders massively underdiagnosed and demand climbing, it's a growing, clean, low-stress niche. And the overnight shifts often pay a premium on top. Sleep clinics are opening fast to catch a disorder that affects tens of millions, most of them never diagnosed. Speed, 7. Worth it, 9. Here's another one where you never touch a patient. When someone needs a crown, a bridge, or a set of dentures, It's a dental lab technician who actually makes it, sculpting and crafting it by hand at a quiet workbench. It's part artist, part technician, completely behind the scenes, and quietly very well paid for the skilled. Dental laboratory technicians build crowns, dentures, and dental appliances, earning from $45,000 to $75,000. You learn through a short program or on-the-job training, no degree, and you spend your days at a clean bench, not in anyone's mouth, no blood at all. Skilled technicians are in short supply, and the ones who open their own lab can earn far more. With skilled lab techs retiring and few replacing them, the good ones can practically name their hours: speed, 7, worth it, 8. And the number one clean, fast medical career on this list is one most people have never considered, and it can pay like a job that took a decade to train for. As the population ages, tens of millions of people need hearing aids. The specialist who tests their hearing and fits the device is in massive demand, earns commission on every sale, and can eventually own the whole practice. Hearing instrument specialists test hearing and fit hearing aids, and the pay climbs higher than almost anyone expects, from around $50,000 to start, past $90,000 for the experienced and board certified, and well over $120,000 for top specialists and practice owners. You get licensed in roughly 6 months to a year, no degree. It's clean, it's personal, there's no blood, and there's a built-in sales commission plus the option to own your own clinic. With the baby boom generation aging straight into needing this service, the demand is enormous and growing. Speed, 7. Worth it, a perfect 10. The cleanest path to 6 figures in this whole video. A few more clean, fast healthcare jobs worth a look. Phlebotomists. Okay, that one does involve a little blood, but the training is lightning fast. Medical coders, pure desk work, often from home. Ophthalmic technicians, another quick eye care path. And if you missed our episode on the hospital tech who fixes life support machines for 6 figures, go back and watch it. It's the king of clean, fast, no-blood medical careers. 7 clean, fast medical careers. No 4-year degree, no crushing debt, no blood, and a short path into one of the most stable, recession-proof industries there is. While college grads fight over shrinking office jobs, these roles are hiring everywhere, and the aging population demand only grows. Which one could you see yourself doing? Tell me in the comments. And if you want the gray-collar jobs that escape the office without wrecking your body, watch this one next.